So welcome to today's Topics in Tech, and it's a pleasure to welcome back Tyler Miguel. Tyler was a tutor in the CIS Sandbox who graduated with his master's in analytics 2018, is that right? Somewhere on there?
17, 18, yeah.
Yeah, and he basically ran the place when he was here, so it's made my life easier. It's great to welcome you back. Tyler's now working as a senior data scientist, and is going to tell us all about what he's up to with data analytics and healthcare. So good to have you back. I will do some screen sharing so you can take control of the whole thing.
Perfect. So let me see if I can take over the screen here. Perfect. Awesome. So I'm going to talk hopefully keep it at a high level about data and healthcare. And I put an asterisk over the data just because, as you will see, data science, data engineering, data analytics, all of those spaces are really kind of mixed together, especially in healthcare. But yeah, before I kick things off, who am I? So this is pre-COVID, Tyler, shorter hair, missing the ponytail, which is now kind of like a bun. We'll see how long that will last for, but maybe once I get back outside, I'll shave it back down. I'm currently a senior data scientist at Devoted Health. Prior to that, I did some work at Blue Cross as an analytics consultant. And actually, when I was at Bentley, I did a fellowship at the city of Boston on their citywide analytics team and supported the work that they were doing there. Some of the things that Mark mentioned. So I was a MSBA student, so the business analytics grad student, and I supported the CIS Sandbox. Personally, really cool experience, met a lot of really interesting people there. The projects were always really interesting to see what folks were building. And I actually came into the virtual, I think, showcase this year, or maybe it was last year. It was the 10th anniversary one. So definitely some familiar faces, and I was able to see a few of y'all's projects, which was really awesome. December, that's what it was. All the dates are kind of mixed in together, but I do recall attending that. So that was awesome. And lastly, I think some of the things, I put some of the interests here, and I think a lot of these kind of intersect with data and really just information in general. I think things that I'm kind of focusing in from a healthcare perspective, as well as from like a social perspective, is really thinking about like social equity and how do we think about opportunities and opportunities for change and equal opportunity in that aspect. Behavioral economics and investing, just some fun stuff. And things that tie more directly to the work that I do is really thinking about data products and how do we influence decisions and change behaviors for folks through data and how we surface data to people. Before we dive in, quick overview. So I work at Devoted Health. Like, what is Devoted Health? What's Medicare? What's healthcare? So Devoted Health is a new organization. We've been around for about 4 years as of March 29th. So it was actually a 4-year anniversary. And we are focused on enabling great healthcare, right? And so some folks say we're a technology company, but we are enabled by great technology, and we support healthcare. We do that through a few different ways. We have a super talented staff. The tech team, the operations team, our member guides team is exceptional. They really think about the whole person in working with people. And so that is like a really great, I would say, benefit of Devoted. We act as a payer. So when you think about your insurance card you may have as you're part of Bentley and you go and get a medical service, you use that insurance card. So we act as that payer. So we basically have those cards for our members. But we also are a provider partner. Basically, we have our own Devoted Medical Group, and we support our providers across the country by supplementing them with additional supports that our team is able to provide. How do we do this? So Medicare in general is a health insurance covered by the US government. Basically, all that means is that rather than you going through your private insurer, the government pays for it. It's usually open for folks who are 65 plus, which is a pretty big portion of the population, right? About 1/5 of the population. And that is expected to grow, which is a reason why we are in this space in part, on top of trying to help support changing the way healthcare is run. There's no question about how healthcare is run today is not optimal. It's not great. I don't enjoy going to the doctor. I don't enjoy going through all the experiences that I feel like I have to as a consumer of healthcare. And so we are trying to work around that and support and really change the system from being inside of healthcare. How this connects is we sell Medicare Advantage products. This is basically the government has their health insurance, they basically contract that out to private companies. We are one of those companies, and that population is continuously growing. So just think of it as like a partnership between the US government and a private company. So quick on the agenda, I'm going to talk about the what, where, and who around generating data, collecting data, and ultimately who gets to work with data. So keep it at a high level for folks who may be interested in healthcare. I know folks who talked about big data, interested in healthcare, will touch on some of those topics. And ultimately, like, what does the problem space look like? Why do I work in healthcare? If you don't want to work in this segment of healthcare, maybe you're interested in other aspects. We can talk about those and use that as a basis to talk about an experience that someone could have being in the healthcare system. Lastly, I'm big on speculation. I enjoy it. I think it's fun to like think far out into the future. So I'll talk about a few of my big bets that I think are going to happen in the healthcare space. Some of them I feel like we're actively involved in now. And then hopefully we'll have time for some questions. So I guess to start, before we kind of like dive in here, right? It's like, what are some examples of data? I think that's always like the big question that folks have around healthcare, right? Like, what does it mean to have kind of healthcare generated? And so I want you all to think through kind of that piece there. And if one of y'all can throw out like, what is an example of data generated in healthcare? Feel free to unmute yourself, kind of shout small thing out. Feel free to also be creative about this if you think you got some far off healthcare data.
I have an idea. Maybe if you're keeping track of someone's vitals.
Great. Vitals. Yep, that's a great one. Any others?
Maybe costs as well.
Costs, another great piece there. We'll take one more if anybody else wants to throw one out there.
History of prescription.
History of prescriptions, yeah, pharmacy data, a really big space that's continuously growing, especially in the Boston area. So as we think about healthcare and as we think about data, those three pieces are very, very different. And who analyzes that data could be very different people, very different companies. And keep that in mind, I think, as we go through this experience. And specifically being, you know, like, let's talk about a story about like what an experience is for someone going through the healthcare system. So person walks into the ER, right? They may have started with some chest pain, maybe some lightheadedness. They call the ambulance. They get dropped off at the emergency room where they now are seen by a doctor, right? An ER attending doctor that then does some tests on that person, may get some medical imaging like an X-ray, and then has that person go inpatient into the hospital. So they're actively in the hospital and they are moved into a cardiologist unit. So based on their assessment, maybe the cardiologist determines that they need a cardiac catheterization, which basically you can think of it as like a little tube being inserted into your body that allows them to do additional work to diagnose potentially if there's a blockage in your heart. And so then they determine like, yeah, there is a blockage there. So they perform a procedure, balloon angioplasty, to ultimately open up basically the veins in your heart to basically get closer, to allow there to stick a stent into it to keep the structure there. So basically opening up a blockage. Then they discharge you home. You may go to the pharmacist to get some drugs. You may have outpatient rehab, so you want to do some exercises to get your heart healthy. And then you see your primary care physician, which most folks would do after the discharge from the hospital. So this is a pretty intense experience for someone to experience, coming from like chest pain, potential heart attack, blockage in the heart, basically being discharged. But this is like one unique experience over the course of someone's life, and they may have multiple experiences in that case. So when I think about healthcare, I'm thinking about some of these experiences and like how we can actually influence them and impact them, what data is generated here, and ultimately what can we do about this. Going back to your experience of like, you know, what data is generated in healthcare, you know, visiting a hospital, there's a record of you going to the hospital. Who did you see? Why did you actually go? What hospital did you go to? What time did you go? Walking around a fitness tracker. So thinking about vitals, right? The Apple Watch can potentially help with thinking about being more proactive in our health data. monitoring blood glucose. So for folks who have diabetes, they may have to prick their finger and determine kind of what that glucose level is in their body. And so that is sending digital data to these manufacturers as well as to your providers. As well as kind of X-ray data, right? Like we have imaging data, so totally different type of data. We have sensor data, we have imaging data, we have biometrics, we have just regular standard claim data. Clinical trials, that's definitely big here in the Boston area, at the very least, because I think we have a lot of pharmaceutical companies who are working on this as well. And then lastly, something that's really fascinating to me is thinking about like DNA mapping and how you thinking about genomic sequencing, and ultimately, how do we think about that next level of data in healthcare? And for folks who are interested in like genetic engineering in that space, I'm fascinated by it. This is not that, but it's very, very interesting to nonetheless. So with that thought of data, right, there's four main, I would say, main verticals and main segments for folks who are interested in working in healthcare data. We have our provider section. So think about folks who are ultimately delivering services to you, right? You have your PCP, you may go to an OT, an occupational therapist, a physical therapist, but you're getting services. Those folks are ultimately putting all of their data and every information that they get from you into their two main areas, which are electronic medical records, health records. Those are the two big sources where they're feeding that information into. And they're basically generating lab results, basically putting in lab results, medical imaging, health assessments. And those are your big Dana-Farber's, Mass General Brigham here in the Boston area. For folks who are a little bit down south into the west, HCA or Kaiser Permanente. And that's kind of like the data that they view. From a payer perspective, so being Devoted Health, we kind of work across a few different spectrums, but one of those main ones is being a payer. These are your insurers. So you have your insurance card, you go to the doctor, somebody pays for your services. You may pay them a premium every month, or maybe you pay Bentley and Bentley pays the premium. But at the end of the day, someone's paying for these services. And those main sources of data are what they call administrative claims. You go to the doctor submits a claim to your payer then analyzes the data, determines how much to reimburse the provider, but that's the data that they keep. And that is there's very rich data source across those two. And they're ultimately thinking about like, what are the diagnoses that a person has? What are the procedures that they are experiencing? And ultimately, how much do things cost? So you can think of those like United, Humana, those kind of big pieces there. Manufacturers is a little bit interesting, and I kind of broke these up a little bit, but you have your device manufacturers. So you can think of those as like Medtronic as being like a really big one. You can think of like continuous glucose monitors, standard glucose monitors. You can also think of these new players, right? Amazon has the new Halo wristband, like that is a device. You can think about the Apple Watch is another big one. Fitbit has kind of been the stronghold for a while. And those are just a few of those pieces. And then kind of this third section is around like sensor data, right? If I am a massive hospital facility and I purchase like X-ray machines or MRI machines, I want to make sure that these things work. And so there are sensors that are pumping some of this information back to the manufacturer to think about how do we improve the way these machines work and how does that kind of work overall. And the last piece is really around pharmaceutical data. So the pharmacy segment is kind of two pieces, right? So somebody who manufactures and develops the drugs. So when you think of like the COVID vaccine, there are folks who are developing this drug over the course of the last 12 months or so. And then they ultimately have to make this and distribute it out across the country. But then there are distributors who ultimately get this to people, get this directly to people. And so, you may think of like CVS pharmacy or like Walgreens as being like two really big distributors. But there are others as well, right? Like a mom and pop shop down the street. That is also a place where you can distribute pharmaceuticals as well. So you have all this data. We have determined kind of what are the big four segments of working in healthcare data. This is kind of like the last piece of information that I think I want to share, and then we're going to go back. We're going to revisit that story that we looked at earlier. This is kind of where the data and comes from, right? So if you can think about working in data, or really any kind of job, you can think about working in a restaurant or something really familiar to you. It's really between enablement and action. There is someone who does something to enable something and then pass that down the line to someone else that enables them to then take an action. And then they make an action to enable someone else to then make an action. And if you stretch and you go all the way down that path, it's kind of from a data perspective, you want to acquire and get the data that you need. And basically process it, talk to people, work through the system to ultimately get a customer or consumer to do something. When you think of like a fully automated system, you think of a system that has done all of that from start to finish. So a fully automated system may be from a digital application where I'm scrolling through Instagram, I get a customized ad surface to me, I click that ad and I go and purchase that product. That is automated, this entire system from they got your data, they use some of your consumer data, they've determined what to then surface to you, and they enabled you to make an action by buying something. That is like a fully autonomous system there, but that's not always how it looks. So when you think of how, when we unravel that, like what is actually within there, you can start to kind of pick specific pieces out. So in our experience, right? So here at Devoted, this is definitely similar with other companies. We have our software engineering team who will build our like front end websites, as well as build the software that we use to gather our data. And then we ultimately have a data engineering team who is processing that data, making sure they're able to get that into a pretty good spot for us to actually use that and make it informative. And basically how that happens now is that our data science team, so me included, and the data analysts and operations analysts across the company will basically build these data pipelines to take this data that we have very raw format and enrich it and make it meaningful, so then we can then pass this over to the business to make decisions. Oftentimes you'll see product management kind of play a role there to help determine like what is important to the business, because at the end of the day, our goal here from like a customer perspective is like, how do we get the right care at the right time to the right people? How do we ensure that we're not wasting resources? We're not making it difficult for people to receive care? How are we relieving the burden from providers or other folks to do some of the administrative stuff that's like pretty boring, to be completely honest? There's a lot of like really boring stuff in healthcare that nobody wants to do. How do we automate that and make it easier, right? These are the questions that we're kind of thinking of. But at the end of the day, it's for the consumer, right? We want to make people happy. We want people to have good experiences. Sometimes we're meeting people at very vulnerable times, right? We have customers and we have members who are part of our Devoted family who go and have procedures and have experiences that like they're not fun experiences. And how do we help to support that? And so we do that through enabling our technology to allow us to make these really good decisions, to enable our member services team and our provider services team, so then they can be the front face of our organization to help our members through experiences and give them what they need when they need it. And I right at the bottom, like, don't lock in too much on titles. I think as you think about graduating and kind of going into like this next phase of your life, the titles are kind of crazy right now, right? Like data what? Usually when someone tells me that they're a data something, I ask them what they do, like specifically, because sometimes I meet a data analyst who's doing some like real hardcore engineering that I would never be able to do. And it's pretty wild, right? There are some people who are processing, kind of doing a lot of this on their own. And the titles really are just kind of like all over the place. So same thing, like for instance, like data science, data engineer, there's a lot of different variability in it. There's analytics engineers, machine learning engineer, site reliability engineer. There are a lot of titles, but specifically the tasks that are happening within that title will always be there, but like who is doing that and kind of how that gets done will continue to change, right? So a lot of these titles weren't here before, but the whole idea is you enable some action to take place that is consistent and will basically go through time, but how these titles change, who does what, will continue to evolve over time. So the problem space, and kind of circling back to kind of where we are with our healthcare experience, there's a lot of problems here and there's a lot of text up here. We're not going to focus on all of these, but the whole point is like, there's a lot of questions that people are asking, but depends on who you are, what company you work for, you're going to ask a different question. So I may be interested in thinking about how do I prevent emergency room admissions for what we call non-emergent issues. So I have a cough and then I go to the ER. I probably didn't need to go to the ER, right? So how do I prevent that from happening? And then some folks, right, like think about COVID-19 vaccine, which drugs are effective? How do we think about efficacy in clinical trials? Like those are questions that I am definitely not thinking of like from a fun perspective, right? And from like the fate of humanity, yes, sure. But from the idea of thinking about how effective the drug needs to be, these are folks who are working on clinical trials as well as pharmaceutical companies. So there are a lot of variability in kind of the questions they ask. But when we think about bringing it back to that experience, right? We have that member experience where someone has a chest pain and they have gone through this and had this like inpatient episode and have had a pretty specific experience. Data is captured at every point. Wristbands are getting really, really good, right? Like these Apple Watches, the Halo, I know there's a few new ones that have got, I feel like new ones come out every day, but they're getting really good at getting your biometrics and have started to show some ability to have basically these sensors on your body that we used to have on machines that can monitor those biometrics. And you show up at a hospital facility, like the location, kind of what information is there, like it's very important. Like we want to be able to identify that and what procedures are taking place, right? Did you get the right procedure? Like that's a question we're ultimately looking for. And then when you go to the pharmacy, like how much drug did you get? What was the supply and how long do you have it? Data is captured everywhere for the ideas that we want to process this and make good decisions about it. So, you know, when did the symptoms start in your chest? When did the difficulty breathing start? We want to know that because we know data is captured. Now we want to know, you know, why did this happen? When did this happen? You know, what admission diagnoses did you have? Why did you go to the ER? What procedure was performed? How many rehab appointments did you go to? Did you go to all of them? Did you go to none of them? Did you go to enough of them? You know, like what are those questions? And they're pretty ambiguous, but those are the things that we are thinking about every day. Every day we're thinking about this from a Devoted's perspective, as well as if you're a provider, a lot of provider perspectives are taking this into account as well. All that's to say, how can we prevent this from happening? So you think about this entire experience, right? The experience of someone who started off with having chest pain, who underwent a procedure in a hospital, and now has rehab and has gone through this kind of long, lengthy experience. Could we have prevented it? Like that is a question we want to know, right? And so when we think about data capture, when we think about that first, understanding the human process is the most important piece. Do we understand the process? We'll start there, because if you don't understand it, then it doesn't matter. And then we're moving into like, what can we capture about it? What questions can we ask? And then we think about what's preventative. Can we step in and actually do something about this? Which basically gets us to our last point. This whole piece is kind of where I'll end like the healthcare and data experience perspective. I think thinking about the problem space is really important. And we can definitely talk in depth about what data is generated here and how do we process that. But ultimately, you know, where does this lead us? Like what is happening in healthcare? Where is healthcare? Where are we going? So my big bets for healthcare and data is ultimately, I think healthcare and life sciences is actually the ultimate frontier. If you think about the last, let's just say 100 or so years from thinking about like US industrialization, as well as like broad global industrialization, we have increased productivity at rates in the last 100 years that were just 400 to 500 years before that. That is going to increase significantly in the next 10, 20 years. And we're going to be able to do those 100 years of innovation in 10 years. And then that's going to move faster and faster. And all of that is fueled through data collection and digitization. Healthcare has been really slow to do this. I'm sure someone somewhere is like still using a typewriter. I would not be surprised. We process paper claims regularly. Like there are people still writing down their claims and submitting them to us. But this digitization will continue to increase. So I would say it's a frothy place to be in terms of having digital skills and wanting to be in healthcare to help kind of digitize some of these like older legacy processes. The second piece, which is very important to data folks, data products I'm convinced data products are going to take center stage. I think the products that I have seen and experienced and even built in the past have been spun up, but like fallen flat. And the question is why? Because we haven't thought about the user experience. We haven't thought about like what people are taking away and actually doing with this data. And so the data product piece is going to be so important because it's build something so that someone can do something. That enablement to action is going to continue. And I think we are on the data side of things, finally being looked at more critically around how do we enable someone to do something rather than how can we do this like really cool data thing. And so data products are going to be extremely important and have definitely started to increase. The third point around data expertise, before it's very much so, you are a doctor, you are a healthcare expert, you kind of decide a lot of healthcare pieces, and then we have like the tech team and some like backdoor business intelligence team who's developed based on some requests. So the healthcare team will have a request, the business intelligence team will deliver it, and we'll send it back. That is becoming more integrated. So I actively work on a team with medical doctors, nurses, operations leaders, engineers, a very integrated team where I am not a healthcare expert. I'm not going to try to say that I'm a healthcare expert. All my healthcare knowledge has been through the benefit of my team sharing that with me. But I know a lot about healthcare, and part of that is because of working really closely with folks who are experts. And so that integration will continue, and that will be expected of folks continuing to kind of push, definitely in the healthcare space, that knowledge is really valuable, and gaining that is not only the technical skills, but also gaining the healthcare skills. And then the last piece, for folks who are interested in like genetic engineering, the last piece is very important. So the evolution of the human is extremely slow. For folks who have read, I think the book is Sapiens, is a really good book. And they basically point out, the author points out the idea, kind of how humans have evolved. There's a few other books that kind of talk about how tech evolves around genetic engineering as well. But at the end of the day, like, we evolve really slowly. So our generations turn over every 20 or so years when people have new kids and they pass on their genes. But the ability to process data and our technology does not evolve every 20 years. It's evolving fast and faster and faster. And so our processing speeds are much quicker, but our questions are still the same. We've always had the same questions. Our questions are not changing, at least at this point. Now that we can actually answer them with really good tech, we can go through and we can simulate data. We can do genetic sequencing at rates we haven't been able to do before. We're going to be actually able to answer the questions we've had. For folks who are really interested in some of the stuff that's happening in healthcare, the concept of protein folding and predicting how proteins fold can help us basically get in front and predict, like, what is the next stage that cancer will evolve into. And like, that's pretty crazy and exciting, right? Like, that's not a space that I'm working into, but that's something I'm very fascinated by. So I think there's a lot of opportunity there kind of in that space. So with that said, I'll come to a close with any questions that folks may have related to healthcare, some data things. You want to talk about GME, I'm okay to talk about that too. So feel free to kind of open it up for folks. I'm free to open it up for folks who may have questions related to any of the above and things that are not even listed here.
Ryan, go ahead. And Tyler, thank you so much.
Awesome presentation, Tyler. I really liked it. I have a general question. Where do you work? Is it like an office space or in like a hospital setting?
Yeah, so good question. I currently work from this space right now, which is not very far. Assuming COVID goes away, I would work in an office. So Devoted Health is located in Waltham, and they have a Waltham office in the Watch Factory, or maybe that's Watertown. It's Waltham. I have not been there. I onboarded virtually here from my house. But yeah, office setting, there are folks who across our company who are in person, like meeting with providers on the grounds in like Florida and Texas and Arizona, who are meeting day to day. And so once COVID is in hopefully a good spot and folks are vaccinated, it is my hope that those will also be places where I will be able to ride along and see providers and understand some of the experiences that our members are having. That only help reinforce some of the data and analysis that we do on the back end.
So you mentioned that all this data was helping make healthcare better, but how are you helping it reach out to people?
Sorry, can you repeat that? I lost it for a second.
So I said that you mentioned how all this data is really helping understand like healthcare better, like what to do, its approaches, what parts in the process kind of need a little bit of fixing here and there. But how are you using that data to kind of make it a little more, especially in the American healthcare system, more accessible to other people? Because you talked about the quality getting better, but like the quantity is something I keep hearing lately over the news. I'm just interested about that.
Yeah, so great question. And for folks who may be less familiar, right? So healthcare is just a mess right now, right? It's very expensive. It's about 1/5 of every dollar that the U.S. spends. So when you think about like our GDP, it's about 20% of it, and I think it's at 22 maybe now. And it's growing pretty fast. So our consumer products grow at about 2% each year. Healthcare grows at about 5% each year. And so simple math will tell us like that is not sustainable. When we think about kind of access and how do we get healthcare kind of to people who need it, there are multiple ways we're doing that now, right? Like, so one way is ensuring that we can keep our prices low, right? So people can purchase our healthcare and get that at an accessible cost. So how can we offer free healthcare? How do we able to not charge people for premiums and basically work within kind of what we have? And the ways we do that is automating a lot of the stuff that legacy organizations have people doing. We started from a point where we didn't have to do a lot of those things. Our tech team is small but mighty. So there's our organization about 800 people. Our tech team's like 70. And we don't expect to continue to scale as the organization scales. So that's one way of doing that, is like making sure that we are efficient in what we do. The other piece is thinking about folks who don't have access to healthcare, right? So there are places across the country that just, you don't have, you may not have like the really strong provider network that you may have in a Boston, for instance, or maybe a New York, or maybe another city like Miami or some area like that. So we have our provider group, which is staffed through Devoted. So this is part of like Devoted's organization. And they're doing a lot of virtual and telehealth, as well as partnering with someone's provider to be able to get access to people. So if you're discharged from the hospital and you can't see your primary care provider, we will then sub in, right? So it's like, tag me in, how can we send Devoted to help? So that's like one way we're doing that. The other piece is thinking about like, how do we, if someone needs to get to the doctor, like, can we call them an Uber? So we have systems where we're sending ride shares out to people, Lyft, Uber, to get them from their house to their doctor, to any types of facilities. How can we get their medication to them virtually? So in terms of like kind of creating access to that, that's really important. But then getting even before that, if we're able to manage the health of people, then we can reduce the amount that the people utilize within the healthcare system. So if I'm going to the ER once every 2 weeks, like that's probably not good, but maybe it's because the medication that someone was getting, they no longer have access to. So then how do we make sure that we get access to that to that medication to prevent them from going to the ER, as well as how do we set them up with a clinical case manager who can coach them and basically help them stay on top of their medication, go to their regular visits, so they're not ending up in the ER or in the inpatient stay. So there's a few facets. I hope I answered kind of your question there with some of those various areas, but I'd like to say it's everything, but we can't do everything, at least not yet.
Thank you. Cheryl, you always have a question. It's your turn.
So I'm wondering, like, how does the MSBA program help you to become a data scientist, and like, why did you choose to be a data scientist instead of a business analyst?
Yeah, good question. So kind of in two pieces to break that up. The business analytics program at Bentley was great. A lot of great, smart professors there. The folks who I was able to work with on projects, I learned so much from. I have a lot of friends who were part of the MSBA program who I still keep in touch with, who are doing data science, product management, doing data engineering, doing data science work at various companies, as well as folks who are data analyst places, people who decided to go in the business route and want to become a business analyst and kind of go up that route. There's a lot of variety there. The reason why so I guess from the MSBA perspective, great place, smart people. CIS Sandbox was a huge help too. Got to give a shout out there. I learned a lot from the folks who did there, because I am not like a Java developer. I'm not like a big engineer side, but I learned a lot from the folks who are developing there and like actually focused on that stuff. So for folks who don't go often, or if you can't go, try to. The other side is kind of why did I choose kind of data science? The kind of mix of skills that I was most interested in building out was more variable around kind of product management. So like, how do I kind of scope the problem and define what problems we're working on, as well as some of the analytical and like statistical solutions to some of these problems. And I wanted to do some engineering, but not a lot of engineering. I have a lot of respect for our data engineers. Our data engineers at Devoted are like super awesome. I'm not trying to be them. They hold the bar very high, but I really like the idea of if I need something done, let me just go into the code and do it myself. And so I think the kind of the mix of those pieces, like scoping out the problem, being able to get technical and build code and build products, as well as being able to kind of think more on the mathematical side, right? The more statistical side in that sense of, how do we reframe the question to get more specific about the technical pieces, I think is like a really important piece. But at the end of the day, I think it's like data science moves quickly. And I want to say like science with like a quote, because like data moves quickly, and I may be wearing a data science hat one day, a data analyst hat the other day, a business analyst hat the other day. And so there's a lot of variability, I would say, in the day. Today, I feel like I'm a business intelligence person because that has kind of been my focus recently, but a lot of variability there.
A question about, you mentioned that you think the healthcare team will be more integrated in the future and the doctors and nurses will be able to kind of analyze the data. And where do you think the data scientists will go in the future? Like, I feel like, I don't know if my understanding is right, but I feel like there are still gonna be people building the data product, but then kind of doctors will be able to analyze data on their own.
Totally. So that is a great point. I'd like to believe, and I work to this, right? Like, I work to try to put myself out of a job, right? So if in a sense where data is really difficult to get to, I have to pull it from our source data, kind of manipulate it, build these pipelines, and then build maybe some dashboards that get delivered to our doctors, and then they're making decisions off of them. If all that was automated, they don't need me to do that anymore, right? But we're at a point where we need to automate all that. But then let's just assume all of that's taken care of and I no longer have to do that anymore. Our doctors are now going to ask really specific questions, right? They're now going to ask questions not of who do I see, how many people do I see, and kind of what are their conditions. The questions are now going to be, given the fact that I have done this intervention, what is the efficacy? What is the efficiency? What are the outcomes of these cohorts? And then now that's the questions are going to start to get more statistical in that nature, where now we're starting to say, how do I evaluate differences? So I think the shape of data science right now and kind of where that's evolved is that there are a lot of places that need you to build data pipelines and data engineering. And so it's more technical, pushes you in one direction. And then so that's closer to the enablement side. On the flip side, there are a lot of places that need help scoping the business problem and actually making it to a analytical question and determining what data sources you need to get, which will push you a little bit more to the business side. But that spectrum of like, what are the questions, and all of that will continue to evolve. I think data science will continue to swing back and forth depending on kind of where they're sitting on there. So that's why I say, like, data analysts, data scientists, data engineers, depends on where you are, could all be the same thing.
Else? So, Tyler, what skills do you think are, for someone who's looking to begin a career in data science or data analytics, what could they best do to prepare themselves while they're at Bentley?
Yeah, so great question. So I would say the first and foremost, and I think Bentley does a really good job of doing this, thinking about the business problem, thinking about the question, right? Like thinking about like, what exactly are we doing? Like, what's the point? Is really, really reinforced, I think, through the school and through the learning. It's kind of like that, so what, now what question. And so I think like really focusing on like, how do you work within a team? How do you kind of product management within a team? How do you support your teammates? How do you kind of plug in and kind of fit to that is really important. And that's very, very important in like the data world because it's very ambiguous. From a technical side, so thinking about like some of the technical skills are important. At the end of the day, like the technical landscape has kind of gone one way and then it just came all the way back again. So folks before were just like SQL everything. And then everyone's like, SQL's terrible. Everyone learn Python. And then everyone's like, we're building everything in SQL again. So that will continue to happen. So from like a technical side, like SQL, just having an understanding of like how development works. Like if you understand how Java works, if you understand how the technical side works, it's going to make your conversations with the engineering side that much better. But one of the things that definitely ties back to the CI sandbox piece is that if you want to work in data, your ability to explain things is going to be so important. And so the tutors who work in the CIS sandbox, thinking about these difficult concepts and how you teach them to other people, you meet them where they're at, and you try to get them to like a new level. And so that is a skill that is really hard to kind of teach someone, but it's really important to develop. And so by showing people, teaching people, thinking about where other people are at is very very important. And that's something that you can definitely get from being a tutor at the CIS sandbox. And I've actually used that in an interview like post Bentley. So recommend, a huge recommendation, I would say, for folks who are in the CIS sandbox.
Thank you. Any other questions? If not, a couple of announcements of things coming up. Sarah, this is your cue. Sarah has been doing all the graphics for our Topics and Tech series. And can you share who's coming up next week? Who's coming up next week?
I can. Let me just pull it up really quick.
Okay. And while you do, I will tell you. Ryan was great. That next week we've got Brian Shield. Brian is the Vice President of IT for the Boston Red Sox. He's going to be on Tuesday. I know most of these presentations are on Wednesdays. Brian's presentation will be on Tuesday at 2 o'clock, sort of in honor of opening day week for the Red Sox. We wanted to get him tomorrow, but he just wasn't, he had other stuff to do, like some baseball game or something. And then on Wednesday, we have Felicia Dodge, who is a Bentley major in marketing. There's Brian. And then on Wednesday, we have Felicia Dodge, who was a marketing major in CIS minor. She is now in charge of social media marketing at Twitter in their New York office. And she's going to be joining us from New York next Wednesday at 2 o'clock. So a double header of Topics and Tech next week with the Red Sox Vice President for IT on Tuesday, and also Brian, and also Felicia Dodge on Wednesday. And then the week after that, our series ends with Philip Desautel, who is going to talk about Internet of Things and smart cities and stuff like that. So thank you for coming. Please tell your friends to come. And please especially come back next week on Tuesday for Brian and on Wednesday for Felicia. And also, if you happen to be on campus and you take a photo in the sandbox and tag it on Instagram with hashtag CIS sandbox, then at the end of the semester, we'll look at what we got and give out some prizes. So if you're on campus, go by and feel free to take a selfie in the sandbox. Thanks again to everybody for coming today. Thanks to Tyler, and I wish all of you a great afternoon.